bore you with all the science jargons and all the terminologies. Toilet infection. And there was this thing called unipels. Despite the abundance of information on this topic on the internet, I still get so many questions about it in the pharmacy.
Baby, show me your color, I want to know your color, Move from this, from that to there. I want to know your color.
What's up, guys? I'm here. I'm a pharmacist and I'm here to help you with your basic health, skincare, and hair care concerns. Before we get into the video, make sure to follow me on my Instagram page at Omotinu, and make sure you hit the subscribe button so that you get more content like this. So in my current practice as a community pharmacist, one common thing that I find that women come to complain about is this yeast infection. It's very, very, very common, and if you're watching this, you're a lady watching this, you probably experienced it before, once or twice, because it's actually common and it's nothing to be ashamed about. According to Mayo Clinic, 3 out of 4 women experience vaginal yeast infection at least once in their lifetime. Yeah, it's that common. And that's why I felt we need to come and speak to you guys and explain to you in simple terms what causes it, what the symptoms are, and how to treat it, how to prevent it from coming back or even coming at all. So if you're interested in this information, please keep watching. Despite the abundance of information on this topic on the internet, I still get so many questions about it in the pharmacy. And so I felt like, okay, let me just do a video where you get all the information you need. Now, most of you might actually know this infection as toilet infection, because that's the general term a lot of people tend to call it, especially in Nigeria. But it's not toilet infection, it's actually called vaginal yeast infection. So let's talk symptoms. How do you know if it's yeast infection? Now, the symptoms you experience if you have vaginal yeast infection is number 1, vaginal discharge. Now, vaginal discharge is actually a critical one because it depends. Normally, women tend to have discharge for different reasons. When it comes to yeast infection, the discharge is usually very thick and clumpy. It's usually white, and in some cases, it actually tends to be very watery. But what you notice about this discharge is that it doesn't actually have a bad smell per se. It just has a light odor, a light yeasty smell. I don't know how to explain it, but kind of like, I don't know, bread or something. That's how yeast infection discharge comes. So if you're having discharge and then there's a lot of odor, it doesn't smell well, it's probably not yeast infection. Second symptom is this stinging or burning sensation when you're urinating or when you're having sex. Another symptom of yeast infection is vaginal rash. Yeah. Especially, I'm talking about the outer part where you're actually seeing that there are some rashes on the outer part of your vagina. Yeah, that is actually a sign of an infection, and it's itchy. You experience itchiness not only on the outer part, you also experience it inside. There's an itching sensation inside, and it's just, a bad irritation, and you're just feeling, you can't scratch it obviously, but it makes you uncomfortable. Like, you can't even sit properly, you're itching. When you're in public, you're feeling the urge to itch. Yeah, you probably have yeast infection. You have an infection and you probably have yeast infection. Another one is actually cracks in the skin outside the vagina. Yeah, that's another nasty symptom of yeast infection. So if you're experiencing 2 or more or all of these symptoms, you probably have yeast infection. Specifically, not toilet infection, yeast infection. Say it as it is. So that when you get to the pharmacy, they will know that you know what you're talking about. Now that we've gotten the symptoms out of the way, let's get into the causes. Why do you have yeast infection, or why do you keep having yeast infection? What causes it exactly? You have to know what causes it to be able to know how to prevent it. You understand? So let's get into the causes. I'm not going to bore you with all the science jargons and all the terminologies when it comes to yeast infection, but what you just need to know is that another name for yeast infection is vaginal thrush. So if you're hearing vaginal thrush, yeah, you're talking about yeast infection. Or you're hearing candidiasis. Now, normally in the vagina, you have a healthy natural balance of light bacteria and light fungi. Just a balance in the vagina that is actually not harmful. What actually causes this yeast infection is when there's an overgrowth of fungus in the vagina. It's when it is too much and it just puts off the entire balance of the vagina and just causes yeast infection. And the fungus I'm talking about is actually called Candida albicans. I just feel like this video is not going to be complete if I don't mention the name, even though you don't really need to bother yourself with that. When this balance is erupted and when there's an overgrowth of fungus, that's when you begin to experience the signs and symptoms of yeast infection. That is just it. That's the basic thing. So what exactly can cause the overgrowth of this fungus in the vagina that causes yeast infections? I'm going to be telling you, and there are quite a few. Now, the major cause that I've experienced in my practice is weakened immune system. Like when your immune system is lowered. I know you all know what an immune system is. I don't need to get into all that. When you have a lowered immune system, you are open to so many infections. You're open to even COVID. And this yeast infection is one of the infections that you're open to when you have a weak immune system. You tend to have a weak and lowered immune system when you're infected with a virus like HIV, or when you're in the habit of taking a lot of alcohol, you smoke a lot, or I should say especially when you don't eat well. That's when you tend to have a weakened, lowered immune system. When you're not eating well, you're just eating basically junks. You're not eating a lot of fruits, a lot of vegetables, a lot of balanced diet, which I'm also guilty of. So if you find yourself keep having a recurrence of yeast infection, then you probably should check your immune system. You should probably eat better, and probably just find like an immune booster. Like I'm going to put pictures of some on the screen so that you know what I'm talking about, like high strength vitamin C's, multivitamins, and all that jazz. Another major cause of yeast infection is obviously poor vaginal hygiene. Obviously, you have to keep everything tidy and clean down there if you don't want to have any form of infection. It's important. You can't be wearing the same panties for 2 days in a row. You can't be using tampons for days on end. You just have to keep it clean down there. Cause of vaginal yeast infection, and most people probably don't know, is wearing clothing that keeps the vagina warm or moist. I don't know if you understand me, like you're wearing wet panties, like maybe you spread your panties and they're not totally dry and then you wear them here. Keeping that area warm, wet, moist is not a good idea at all. That is also why when you go to the toilet and you go and pee or you do whatever, you wash with water. Just make sure you use a towel to pat it dry too, so that when you wear your panties, it doesn't end up getting warm and moist. And anywhere that is warm and moist is usually a breeding ground for bacteria, fungi, and all that. So just make sure you're wearing underwear that can breathe. You're wearing clothes that are not wet, that are not too tight. Now, one cause of vaginal yeast infection that I want to really lay emphasis on is the overuse of antibiotics, because this is a problem and most people are probably guilty. If you're one of those people that any little infection you have, any little issue you have, any little sickness, you're just running temperature, your nose, you're just having catarrh, and you just go to the pharmacy and you just ask for antibiotics. It's not a good idea. Overuse of antibiotics can actually also cause vaginal yeast infection. I'll tell you why. This is because when you use antibiotics too much, I told you there's normal natural bacteria in the vagina, normal natural bacteria in the body that is more beneficial than harmful to you. So when you find yourself using antibiotics, you're killing bacteria. Probably you're killing the infection, but at the same time you're killing normal, healthy bacteria in your body, in your vagina. And when you do this, obviously the fungi is just going to sprout and overgrow, and this is going to cause vaginal yeast infection for you. So just limit your use of antibiotics totally. Another cause of vaginal thrush that I want to hammer on, which is probably one of the most common causes, which a lot of people don't put into consideration, is this practice of vaginal douching, or this practice of using scented soaps or shower gels or whatever to wash your vagina. I personally believe that anything other than water should not touch your private part at all, your vagina in particular. Anything more than warm water should not touch it. Stop using Dettol, water containing Dettol or Dettol soap to wash your vagina. Is a bad idea, because you're killing the bacteria that is there. You're killing the normal bacteria that you need that is there. Stop using shower gels. It's a bad idea. When you have your bath with your soap, your sponge, water, whatever, when it comes to your private parts, just use water. Use water. If you must use soap, make sure you're using a mild toilet soap, a very mild one that is not scented. Because I know a lot of people tend to like to use vaginal wash, vaginal douching, vaginal that. There was even a period that there was this thing called yoni pills. I don't know if you guys know it. That was raining then. They're like, okay, if you have vaginal odor, if you want to cleanse your vagina, use yoni pills, and then you put it inside yourself, and then no. That was just a bad idea. If you have if you're experiencing vaginal odor or whatever is smelling, you probably have an infection. It's best to just take treatment and tackle it, and trust me, it will go away. Other causes of vaginal yeast infection include pregnancy. Yeah, I know this is not a fair cause, but yeah, it happens when pregnant women tend to get prone to yeast infection, and also using certain medications such as contraceptives. If you're in the habit of using contraceptives a lot, post-pill, post-Eno and the likes, bear control, use them a lot, you're likely to be prone to vaginal yeast infection. Thank you very much, and how to prevent them, because we know the causes, so you know what to do and what not to do. Let's just get into the treatment. And the good thing there's no good thing about having an infection, but at least the good thing about vaginal yeast infection is that it's actually quite easy to cure. It's one of those kind of infections that once you just take the treatment within possibly less than a week or 2 weeks, you're already okay and you're feeling fine and you're good to go. So when you have vaginal thrush, what you need is just one or two of the following. The oral medication, the cream. The oral medication, the one you take with water, and the cream, the one that you apply, or the pessaries, they are the ones that you insert into your vagina. Now obviously the cream is for the rash, around the vagina. There are also vaginal creams that you can actually insert into the vagina for the itching. So I'm going to give you a few of these medications. I think there are actually a lot, so I might just tell you the ones that I prefer or the ones that I've found in my practice that actually works best, or I've gotten a lot of good feedback about. So I'll just be direct, so that if you're experiencing this, or if you experience this in the future, you just try those medications and they will work for you. These are just this special pill that you insert in the vagina through the help of an applicator, and the ones that I've seen that really works are the clotrimazole pessaries. So if you go to a pharmacy and you tell them you want a clotrimazole pessary, there are different brands, and they will probably give you one that is very good. Now the one that I prefer and I tend to give a lot of my patients is the Vaginal vaginal pessary. Now this Vaginal vaginal pessary actually has clotrimazole that I mentioned. That's an antifungal, because you're treating a fungal infection, so obviously you're going to get an antifungal. So the clotrimazole is an antifungal, but Vaginal has clotrimazole. It also has metronidazole, which is an antibacterial. So you're getting 2 for 1 in that Vaginal pessary. I'm not actually sure if I should be recommending brands. Probably I should just be telling you, okay, clotrimazole pessary, and then when you go there, you can just get any brand you like. But I'm just telling you what my preference is and what I've gotten good feedback about. I'm not saying you should actually just go and get those ones, but trust me, they work. Another pessary that is actually quite common that works too is the mycotin pessary. It contains clotrimazole also. Another one is the teoconazole pessary, which is also a very, very good one. Now the thing about these pessaries is that some of them, like the Vaginal, I think it contains 6 pessaries. The gynotalcocid contains 3. The important thing that you have to know is that you should finish using it. That 6 is for 6 nights. So you use it before bedtime every night for 6 days. Make sure if you're using it, you finish it. That is key. Because if you don't finish it, there's every possibility that the infection is going to come back. So if you have actually noticed that you tend to treat vaginal thrush infection a lot, probably it's because you're not finishing your medication. You just use 2 or 3 and you're feeling okay, and then you just throw it away. If you have the symptom, which is the rash that is just on the outside of your vagina, you can get clotrimazole cream to apply to that area to ease the itching and just ease the pain. One that I tend to recommend a lot is Clotridam. For the oral medication, which I found that a lot of people don't actually like to use, but funny enough, it's actually more convenient than inserting something into your vagina. They're just a very short regimen. There are some that you just use for 1 day, there are some that you just use for 3 days or 7 days, and you're done with it. Before you're even done with it, you start to see improvements. But like I said, make sure you finish it. That's key. So for the oral medication, you need antifungal that is called fluconazole. This fluconazole tends to be a single dose, which means that you just take it once and that's it. So the one I tend to recommend for my patients is the diflucan. It's actually 50 milligrams. There are 3 tablets in it, but you're taking the 3 tablets at once. So that's why I like to combine the oral with the pessaries. You're taking the oral at once, and then the pessaries, you're taking it for like 3 to 6 days, 6 nights. Yeah. And before you know it, you're feeling better. So far, you finish your drugs, you're okay. And I really don't want the video to be too long. So let me just mention some basic things that I feel like you need to know, and then that's it. Vaginal yeast infection is an STI, that's a sexually transmitted infection. It is not. And whenever you go to the toilet, make sure you take your tissue along. And yeah, don't use anyhow soap, anyhow shower gel. For me, you cannot be too clean in this life. You can't be forming clean and then you go and take something that is just going to totally throw off the pH of the vagina and then cause an infection for you. Don't go to a spa and say you want to do vaginal facial and then washing your vagina with all sorts of things that contain chemical and scented stuffs. You're going to throw your pH balance way off. Avoid putting shower gels there, perfume, scented soap. I cannot hammer this enough. Do not use antiseptic soap to wash your private parts. It is a bad idea. Do not use antiseptic liquid, Dettol, Savon, Tetmosol, all the salts. Don't use it on your vagina. It is a very bad idea. Trust me. I know. Limit your antibiotic use. Take proper diet, sleep, and exercise if you can, just to be able to boost your immune system so you're not prone to so many infections. Not just yeast infections, so many infections. If you're experiencing serious odor, fishy smell, or whatever, just try and go speak to your pharmacist, speak to your doctor so they can give you a proper medication. Don't go using all those things and putting it into your vagina. You need pills, detox, whatever, and then you're even making matters worse for yourself. Trust me. Speak to your doctor or your pharmacist if you're having odor. It's probably not vaginal yeast infection, but they will tell you what it is and they will give you what you need. So if you have any questions, just hit me up in the comment section. Let me know if this video helped you, and let me know what you'd like to know. Like I said, follow me on Instagram. If you really have personal questions, you can put in the comment section. You can just shoot me a DM, and trust me, I'll reply you. Alright guys, I'll see you in my next video. Bye.